keep letting people in and I can just do welcomes. Good evening, everybody. Welcome to our North Yorkshire Safeguarding Children Partnership evening learning event for our early years practitioners. We are absolutely blown away, as we always are, with the turnout from you guys, especially that you're giving us your time on an evening. So welcome. Just a little bit of housekeeping. For those of you who don't know me, I'm Kat Morris and I'm one of the Policy and Development Officers for North Yorkshire Safeguarding Children Partnership. You won't be hearing too much from me this evening, which is probably no bad thing because we've got an amazing agenda packed full of lots of amazing information for you. But I'll be in the background, just kind of moving the slides along, managing the chat if there are any questions. Move that along. So in terms of housekeeping, we do record the sessions just so you've got it as a resource where you can share it with your teams, and that'll be available on the YouTube channel. If you give me a chance to edit it down, it might likely be Monday now, but hopefully I'll try and get it on tomorrow for you. And we will send you an email with a copy of the slides as a PDF as well. So if there's any links on there, you'll be able to access the links as well. Just to help with the recording, it's always really helpful if you can make sure your microphones are on mute. It just takes some of the background noise off. And if you're not presenting, if you want to turn your cameras off as well. If there are any questions, please add them to the chat and we can pick them up as we go along. The only thing we would ask is if you are asking questions, you just refrain from sharing any personal information about any young people or families. As always, there will be an opportunity to ask any additional questions if you don't feel comfortable doing that as part of the recording. At the end of the session, I'll turn the recording off and myself and Helen and hopefully Kelly or Joanna will stick around for an extra few minutes if there are any extra questions. If we can't answer them, we will take them away and we'll find out and we'll drop you an email and come back to you. As I've already said, we will make sure the slides and the recording are available to you. The other thing that you will get is an email from NYS and they will ask for a little bit of feedback on how the sessions run. It's always really helpful for us because it helps us think about what we do for the next one. Once that's completed, you'll get your certificate of attendance as well. So just to run through the agenda for this evening, we will get you away for 9 o'clock, we promise. We know it's a late night for everybody and you've probably all worked very hard today. So we will, I'll hand over to Helen in a minute, who's going to do some introductions, and then we will have an update on the EYFS changes with Joanna and Kelly. Then we've got Angela Campbell joining us, looking at meeting the needs of early years children from military families. And we will finish with Sarah Stansmore, who's our designated safeguarding nurse, who will do a presentation on perplexing presentations and fabricated or induced illness in children. So that's our agenda. I will now happily hand over to Helen, who'll just do a little bit of an introduction. But I'll be in the background if you need me throughout the session. So enjoy your evening. Thank you.
Lovely. Thank you, Kat. Hi, good evening. And again, just thank you so much. Just to reiterate what Kat said, we're absolutely delighted that so many of you have joined again for tonight's Safeguarding Online event. Thank you to your commitment and your continued commitment. As always, the evening is about building on your existing safeguarding knowledge and thinking about safeguarding in its broadest sense. So we'll be exploring, how to remain professionally curious about the children and the families in your setting and how this curiosity supports sort of effective safeguarding practice. As Kat said, we're absolutely delighted that Sarah's joining us. Again, this was feedback from the last event about fabricated illness, and Angie about working with the unique needs of children with armed forces families. I'm also really pleased to introduce Joanna and Kelly to you, who will be following me. They're our safeguarding advisors. And Joanna and Kelly's sort of engagement is part of that wider package of support that's been agreed by the senior leadership team for the early years PVI sector this year. So I have shared information with PVI providers about accessing sort of high quality training and CPD opportunities. And many providers have already booked onto the training, including the Early Years Leaders Forums in November, But there is lots of room because it's online. We've really no upper limit. So please, I encourage you to access this subsidised training. It is being paid for by the local authority this year. And obviously your engagement in this will actually sort of enable me to sort of try and make it continue for next year. The whole point behind it is to actually provide you with that free training to strengthen your safeguarding and your early years practice, to support children's development, and to just build your confidence in meeting sort of Ofsted expectations. So again, like I say, please encourage as many of your staff and team to book on those opportunities. Because it will help me make the case for next year. And again, all of the training, it's looking ahead, looking at Ofsted's new inspection framework, those 6 key areas, which I'm sure you're all familiar with now, not least safeguarding, which will only be judged as met or not met, and then the curriculum and teaching, achievement, behaviours, attitudes and routines, children's welfare and well-being, and leadership and governance. So I will put, I should be able to attach the document, but everybody's been sent it and you can book everything via NYS. I will now have great pleasure in handing over to Joanna and Kelly.
Thanks, Helen. So, hi, welcome everybody. And again, like Helen and Kat have both said, we're absolutely blown away by how many of you have attended tonight. Joanna and I do a lot of training, don't we? But we've never had these sorts of numbers before. So thank you all for taking the time out. So, like Helen just said, we are North Yorkshire Council Safeguarding Advisors. So our role predominantly sort of day to day is supporting all local authority schools in North Yorkshire. But then we've been, really privileged and really excited to be supporting all of you as well this year. So background, I was a teacher for 20 years and worked in another safeguarding team within a different local authority. Joanna, do you want to say a little bit about yourself?
So hi everybody, I'm Joanna. So my background is early years, NNEB trained, used to run nurseries, and then I went into further education and like Kelly worked in a front door team for a number of years. So lovely to meet you all.
Thanks. Thanks, Kat. Okay, so we've just thought we'd put a slide in here. Obviously, like Kat said, you will all get a copy of this slide deck after the presentation tonight. You probably get it tomorrow or Monday, but we thought it'd be really helpful just to have our emails on there as well, because often with things like this, questions do arise. So we thought it was important to put those on there so we could support you in any way we can. Thank you. Again, anything with safeguarding, we always sort of give this warning really, because Joanna and I, when we present to whether it's, to yourselves, to school, to governors, we do often use case studies in our training because we think that's really important part of it, and it can be upsetting. And however many times Joanna and I present these things, it is upsetting for us as well. And sometimes, things can trigger an uncomfortable thought or memory for yourself. So, if that does happen this evening, then please take time away, and we totally understand that and there to support. Thank you. So we thought we'd just do like an overview of the session tonight. So I'm going to be sort of covering the first part, and then Joanna's going to then move on and do the second part. So the first thing we're going to obviously look at is the role of the DSL, the designated safeguarding lead. So we're going to sort of talk about that. We've put in brackets there, pre-recorded webinar to become available. And like Helen said, we've got time to put all these things together to support you in your settings. And we thought that would be a really good one to do. So we're going to put together a pre-recorded webinar that you can go onto the website, onto NYS, and you can basically download for free and watch it. We're aiming to sort of do those around sort of 20-30 minutes each, so they won't take too much of your time. I'll then be looking at safer recruitment, so looking at that suitability of staff, then looking at safeguarding policies and procedures, then looking at child absences, Then we're looking at whistleblowing and low-level concerns. And again, that is I've actually put that together last week, a low-level concerns webinar, again, that you can access for free. I'll talk to you about that in more details in a little bit. And then Joanna's going to then talk about paediatric first aid training for students, safer eating and nutrition guidance, which obviously we're all aware of. That's quite a sort of a big change from the 1st of September. And then toileting and privacy, and then looking at safeguarding training. And then we've just got a section at the end which is further training. We've got some links and sort of signposting for you there, which hopefully you'll find helpful. Thank you. So obviously these are the two documents which are statutory from the 1st of September, and these are obviously the early years foundation stage framework for group and school-based providers, and then obviously the same version but obviously slightly different for childminders. So that's what we're basing our training around tonight. Thank you. So this is just sort of an overview of what those changes have been. Like I said, from the 1st of September, they've further strengthened the requirements within them. So again, I'm not going to read all of this out because obviously we're talking about these in more detail when it comes to our section. So there'll be amendments around safer recruitment. There's new requirements around whistleblowing. New requirements for providers around if a child is absent. Then we're then going to look at early years students and trainees and expectations for them. Then we're looking at safeguarding training and what's available for you. Then children's privacy, which Joanna will go into more detail with, and safer eating. So that's sort of the overview really of the changes, and they're the areas we're focusing on tonight. Thank you. So like I said before, the role of DSL, and there will be a pre-recorded webinar available for yourselves, which will obviously go into more detail about the DSL, the designated safeguarding lead's role. But obviously now you are called that DSL, and you are responsible for liaising with children's service agencies and with the local safeguarding partners. So obviously there's lots involved in your role, and that's what it's now called, the DSL. Thank you. So sort of an overview then of the role of the DSL. We've sort of tried to put this together sort of as briefly as we can, but obviously the role is quite vast, and that's why I would sort of encourage you to download the pre-recorded webinar when it's available and have a look at that. So as the role of the designated safeguarding lead, it's making sure that staff understand the signs and indicators of child neglect, making sure that staff have that training so that they understand how they can, identify those vulnerabilities and also protect children from abuse or neglect. It's making sure that you have a safeguarding policy in place and that it's clear and that all staff understand it. And we talk when we go into our settings about that understanding, which is key. I think, we can easily give somebody a policy and ask them to look at it, but actually it's making sure they've understood it. So, whether it's doing quizzes or, asking those questions around what was within that policy, I think is always really beneficial. Making sure that all staff are aware of how to raise safeguarding concerns. So what systems do you have in place so that they can do that? Making sure that you've got those robust risk assessments in place so that any concerns that are raised or identified you can use that sort of that level indicator tool when deciding whether it needs raising with the local authority or not. Monitoring those children who are subject to child protection plans, and we talk about that a lot when we go into settings. So it's looking at your most vulnerable children in your setting and making sure that those children are monitored, and then maintaining those accurate and secure child protection records. So whatever system you use, it's making sure that they are factual, they're maintained, they're monitored, and obviously you look at those to make sure that child is supported. And if you need to contact another agency, then that's obviously what you'd put in place. And then that sort of general monitoring, auditing and evaluating the effectiveness of safeguarding. So always be looking at your policies, looking at your procedures. Are they effective? Do we need to change anything? Do we need to do any more training? And I think Joanna and I always say to designated safeguarding leads that we support, it's that drip feed of safeguarding for staff as well. It's keeping them up to date with things all the time. So I think that's key really in your role as DSL. Thank you. So Safer Recruitment has had some changes as well around obviously employing those suitable people. So in the group and school-based provider version, it now says that obviously providers must record information about the staff qualifications and the identity checks and vetting processes and references that have been completed. So it's making sure that those references have been obtained. And then with the childminder version, childminders must obtain a reference for any childminding assistants that they employ. So that's really important as well. So the key part there is making sure those references have been obtained. Okay, thank you. So just the overview there of Safer Recruitment. So it's obtaining those references from current employers or training providers before employment if they've obviously just come into the world of work, including those vetting, identity checks and qualifications in the recruitment procedures, and updating safeguarding policies to reflect the recruitment process. I think that's key as well. So it's really clear and sets out exactly what you as a setting, you as a provider are going to be doing to check the suitability of candidates. The link there as well, which is really helpful, just at the bottom of the slide, which is a template that you can use as a reference template. So we've just put the link in there for you. Thank you. So then looking at safeguarding policies, the new part at the bottom here in yellow is procedures to follow to check the suitability of new recruits, which we've just talked about. But then it's also making sure that there's detail of how safeguarding training is delivered and how practitioners are supported to put this into practice. And I think that's, that's really important. It's making sure that there's a schedule, for the year. So making sure that everyone's done the training that they should have done, testing their knowledge to make sure that everyone knows what the procedures are and that they're following them, and that you've got that clear sort of overview of what training your staff are going to be accessing throughout the year, and that's recorded somewhere so that can be monitored and evaluated as well. And obviously within the safeguarding training, we always say to our settings, think of your contextual sort of incidents and sort of areas of concern as well, because actually that could be something that you really need to be supporting your staff with and making sure that they're trained so they can look out for signs, whether that's domestic abuse or county lines. It's making sure that your staff are trained around those contextual issues for your setting as well. And obviously all settings are different, might be rural, might be more central in a town, so it depends, those contextual concerns can change depending on the area. Thank you. So like I said, we'll be looking at child absences. So there's quite a lot here. I'm not just going to sit and read all of this information, but we wanted to include it on the slides because obviously you will get a copy of these, so we thought it would be good for you to refer to. But it's making sure that any absences are followed up in a timely manner. It's making sure that parents are contacted, having those contact lists. We always say to maintain at least 2 emergency contacts per child. That's important because obviously if the first contact there's no answer, you've then got another one to actually then contact somebody else that the parent has agreed can be on those emergency contact list. And that timely aspect is key, isn't it? I think it's making sure that it is followed up and it's it's checked to make sure that the child is okay. Providers must consider patterns and trends. So again, with anything with safeguarding, this is an area that we always, advise that you're looking, you're doing that monitoring, you're checking to see if there's patterns of certain times of, or certain times of the week when the child is absent. Is it to do with personal circumstances when, they're at a particular parent's house? So there's all sorts of things, that could affect the child not being in the setting. So that's something that really needs to be recorded and monitored and acted on. Consideration must be given to the child's vulnerability and even, the parent or the carer's vulnerability in their home life as well. And if, you do have concerns in your setting, then it should be referred to the MASS team, the social care team, or you can request a police welfare check as well if you're really concerned about the child and the family. And then it's having an attendance policy in place as well, and this being shared with parents or carers so that everyone is aware of what your procedures are at your setting. So if the child doesn't attend, it's really clear as to what you would do as a setting, so that everyone is aware, parents, the staff, about reporting those child absences and making sure that everyone is clear of what will happen if that isn't followed up. Thank you. So like I just said, we'll be looking at whistleblowing and low-level concerns when we're thinking about concerns around the child's safety and welfare. So whistleblowing procedures is where staff, if they have concerns about another member of staff, they can raise concerns about poor or unsafe practice in the setting, and they must include when and how to report concerns in the process that will be followed after staff report concerns. So the actual policy needs to be really clear as to what staff would do if they were concerned. And I think, you know, that's we sort of advise that in all the settings that we go to, that a whistleblowing procedure is in place. Also, providers and childminders must ensure staff are aware of the settings whistleblowing procedures, so making sure that's shared, whether that's at a staff briefing or information is shared electronically, and making sure that staff feel comfortable and that they are able to raise concerns as well about poor or unsafe practice. And I think, you know, when you look at serious case reviews, you know, Joanna and I always say this, it's actually maybe staff feeling uncomfortable about raising that concern because they work closely with, you know, the people within the team, and but actually it's, you know, it's really important that the policy states what that person should do and that it will be followed up. Like we said, obviously we're pre-recording webinars to support you and in your day-to-day. So we are going to be putting one together for low-level concerns as well. So a low-level concern is where you have a concern, a nagging doubt we call it, about somebody else in the setting, and that's recorded by the DSL and monitored. Okay, so it might not meet that whistleblowing standard, it's just below that, but it's making sure that any low-level concern is recorded and it's followed up by the DSL and that person is spoken to, and then it's tracked and monitored to make sure that that behaviour doesn't happen again. Thank you. So I've just done a slide here, really sort of signposting yourselves. So if you do have concerns about, you know, regarding children's safety and staff members, these are sort of some numbers you can phone, websites, email addresses. So you've got people that you can, you know, you can go to for support around whistleblowing. So the numbers are just there. So obviously you'll have a copy of this PowerPoint so you can refer to this. And then the document at the end is really good guidance around what is a whistleblower. So it's just, you know, really good to sort of read through those and feed that back to your staff as well. Thank you. Okay, Joanna, thanks.
So thanks, Kelly. So I'm going to talk through the further updates. So firstly, I'm going to talk about paediatric first aid. So obviously there's an amendment around early years staff having paediatric first aid in order for them to be included in staff to child ratios. So all staff who have completed, this is a point that's been added, the experienced base route must obtain a paediatric first aid qualification before they can be included in the staff to child ratios at level 3. And to continue to be included in that ratio, they must to renew that certificate every 3 years. So if you've got any queries about that, you can look in the experience base route in early years guidance from the DFE. I can stick that in the chat when I've finished talking, and they have updated that in September to ensure it's got these new requirements in. And then there's been a further change around paediatric first aid in the new safer eating section, which I'm going to cover in a minute, around whilst children are eating, there must always be a member of staff in the room with a paediatric first aid. So that's a big shift in change, where there used to have to be a person on the site, in the room, but this is on the premises, but now it's actually in the room. So, and in Appendix A, there is a criteria of what the paediatric first aid should look like, what should be included. So it's quite clear guidance on that now. So the next slide I'm going to show you is around why that might have come apart. So it's just a bit of a health warning because it is a sad case, really. But there has been a case where the coroner has flagged up concerns over first aid training and early years settings. So I'm going to share that now. So please look after yourself while I'm sharing this sad case. So it is around Oliver Steeper and his tragic death. So Oliver died in September 2021 after a choking incident in nursery. Some of you may be aware of this case, others may not. But Oliver had choked on pasta while at nursery. Zoe, his mother, had shared that he had been eating pureed meals at home, and she'd have been assured by nursery staff that solids could be blended before being fed to him. On the day of his death, the pasta that was fed to Oliver had not been blended, but instead it had been chopped into small pieces. So there's a lot more to the case, and there is the link there if you want to read more about it. But I've just pointed out some of the key parts. So the key workers had their evidence shared that they've not received training about the size of food that should be served to the young child. Or other children in the nursery, and the coroner had told the jury that there was no evidence that there was failures by the nursery or its staff. However, the coroner raised concerns about the early years guidance at the time, where there only had to be one staff member present with a valid first aid certificate in a nursery setting or early years settings. So this might be one of the reasons for the changes to the next section on food safety. Sadly, this is not just one case, there has been another couple of cases where children sadly have died in the EYFS, and that's around, again, food being given to them that didn't meet their needs, their allergies, and causing their deaths. So, but this is just one we're sharing with you today. So next slide, please, Kat. So, like I said, there is now a new section within the health section of the safeguarding part 3, and that's around safer eating. So what the DFE have done, they've taken the information that was already existing on the Food Standard Agency within the early years DFE food safety advice, and they've brought that all together. So some of this won't be new to yourselves because it was in existing guidance. What they've done is they've brought that all together and put it in one section under safer eating, and then they've added some additional requirements. So I will quickly go through this part because I think it's really important with the key changes. So like I've just said, the first key change is around that there should always be a member of staff within the room who is a qualified paediatric first aider. So that's a big change for settings. This one hopefully is already in your practice. Before a child starts to the setting, it's about gathering that special dietary requirements, food preferences, food allergies, intolerances, anything that needs to be known about that child, including special health requirements. And again, the age and the stage that child's at for feeding around having solids. And all staff must have access to that information. So if you think sometimes especially in the setting base, you might have different rooms where staff move from room to room. So it's really important that all staff are aware of children's needs if they're providing cover in additional areas. And at each meal time and snack time, it must be clear who's responsible for checking that food is correct for that child and meets their requirements, so it is safe for them to eat. So that's the real key point, really. And then the key point around that is to remember to check food. So if food's been brought in from home from parents, have we checked that food? And also thinking about our wraparound care arrangements. So if you're providing wraparound care, is that food at breakfast stuff, after school and holiday club suitable for that child? And again, with this is just not our early years children, we might have older children with allergies and intolerances. So really key. I think Helen wanted to mention something about packed lunches here.
Yeah, all it was, thanks, Joanna. It was the healthy packed lunch guidance that we issued. I know it came out in June, but prior to that, we sent it out, I think probably about March as well, earlier this year. The North Yorkshire Healthy Packed Lunch Guidance for children aged 2 to 5. And I was in a meeting the other day and we were discussing this and about revising it. And really, it was just a bit of a straw poll, really, just to use the chat bar that, first of all, do you use the North Yorkshire Healthy Packed Lunch Guidance, or do you have your own? If you do use the North Yorkshire one, does it actually meet your needs, or does it need things sort of putting in it? So yeah, I mean, I can pop the link again in the chat bar. But yeah, if you could just pop in the chat bar if you do use it, or if you use your own, that would be really helpful. And I know we're going to be doing more work on this, but just to actually give us just that little bit of just really understanding, sort of in a very broad sense, really. So thank you, Emma. Yeah, you use the North Yorkshire one. Thank you.
Yeah, that'd be good to know if people want some input into it, isn't it? It'd be
That's
really
right. Yes,
helpful.
please. So if you could just pop in the chat bar, and what I will do is I'll pop it in the next key messages in next week's key messages. I'll pop it back in there as well. You can have another look at it, use it, but also, you know, if there's things in there that you think need to be in there that aren't in there, please let us know, because we can. That's brilliant. Thank you. You know, because we can change it because it has to meet your needs.
Helen, just while people are putting a few bits in the chat,
Yeah.
I didn't want to lose a question that had come in from someone just a little bit earlier on. They'd asked about if you've got students on placement from school or college, do they need the PFA training before commencing the placement? So they have students that are never left unsupervised and all the staff are PFA trained, but it's just if they're on the premise while they're on the placement, do they need that training?
Is that for me or Joanna and Kelly, or
Do you want me to answer what I
Do you want
think?
to take that one, Joanna?
Yeah, so if those students aren't included in the ratio, then they won't need that. But if they're students and trainees that you are including in the ratios, then they would have to have the first aid. Is that right, Helen? That's what I can take from the guidance.
Yeah, absolutely. And it would be part of that induction process as part of the student starting with you. I mean, obviously, you know, understanding those roles, responsibilities, the safeguarding requirements. But if they're, you know, and you could give them, you know, some overall paediatric training, you know, or information. But as Kat said, if they're not going to be left alone, which you wouldn't be doing with students or anything like that, well then no, they don't need to have it before they start their placement.
Just if it's normal placement, it's just for those ones who's including your ratios, isn't it? And it could be supervising, couldn't they? Could be supervising lunch while you're changing a child. So it's really important. We'll say in a minute around that watching children and being aware, really. But like you said, if they're not including the ratio, it's about maybe having some training. It'd probably be good if the colleges kind of maybe front load that and have them trained before coming
Yeah,
out. Would
yeah,
be really probably
definitely.
good, wouldn't it? So hopefully they'll be aware of this guidance, and maybe they're looking at their practice to support providers, because it's
Yeah.
really key, isn't it? Because they are working closely when they're on placement. So yeah.
Yeah, absolutely. Yeah.
So hopefully
And
that
we do
helps.
work with colleges, so it's possibly
Yeah,
something we can feed back to the colleges as well.
yeah, would be
But
useful,
yeah,
wouldn't it?
and thank you for your comments about the packed lunch. That's really helpful. But please just keep popping them in, because then, you know, I'll collect them afterwards and share with my colleagues in public health.
Brilliant, thank you. And thanks for picking up the question, Kat. So again, around the safer eating, there should be ongoing discussion with parents and health practitioner where appropriate to develop action plans for those children who will need to manage their allergies, intolerances. And again, in this section, they've put lots of links to support you with this work. So the Royal College of Paediatric and Child Health have a action allergy plan that you can lift and use to put in that child's photo, the information, what needs to do in emergency. So that's a really good document. You might already have your own, but it might be worth looking to make sure that you've got everything that they're advising for you to include. Then it's about sure that all staff are aware of those symptoms and treatments for allergies and anaphylactics, and the difference between allergies and intolerances, and that children can develop allergies at any time, especially when you're inducing solid foods, or it might be new foods that those children haven't eaten before at home that you're giving at snack and lunch, snack and meal times. So it's really important that you are aware that children can develop those allergies and intolerances at any time. And with that section, there's lots of links to the NHS key guidance around introducing solid foods. So next slide, please, Kat. So again, introducing solid foods to children, there is a paragraph on that, and the key information is about taking into account the stage the child is at in regards to introducing solid foods, including to understand textures the child is familiar with. So if you think of the sad Oliver Steeper case, you know, he was used to blended food and then he was given, you know, very textured solid food. So, and again, not making assumptions based on the age of the child. It's remembering to think that every child is maybe at a different stage, you know, depending on their experience and where they are. So just don't group that, you know, these children should always be having, you know, solid food. And that food must be prepared for each child's individual needs, working with their parents. Again, thinking of Oliver's case, that parent had said around food needed to be blended, and then working with that parent before moving on to the next stage. And it's got to be at that right pace for that child. So thinking about that, again, they're just reinforcing information that has been out there for a while around preventing choking in children. So there's the early years choking hazard food safety information from the Food Standards Agency. Again, we'll put that in the chat and send it out. And that's a chart of information that should be avoided with very young children. And those foods that, if prepared correctly, if you prepare them correctly, they will reduce that hazard, choking hazard. So again, thinking about, have your staff been trained around that? There is a really good video we'll put at the end of the presentation. It's a 3-minute video, someone showing about those high risk foods and how, if you cut those up in a different way, reduces the risk of choking. So have your staff seen that recently, and have they seen that Food Standard Agency's chart and the advice they give out about those high risk foods? So again, you know, and if you've done some training, a session with them, record that and put that on your training records, because that goes to your wider safeguarding training. So babies and young children, what they're saying is clearly they should be seated safely in high chairs or appropriate size low chairs while eating. And the additional point they've put in is, where possible, a designated eating space should be available where distractions are minimised, and that where possible, to ensure that children are sitting the staff are sitting facing children while they're eating. And what's always been in there about them always being in sight and hearing of a member of staff, but it's that additional about ensuring that you're facing, and that is where possible, because if you're a larger setting, you can't have all the children facing you, and you do like to sometimes sit them in like family groups, but it's having that awareness. So and the reason for that is, again, to be aware of that choking. It is a silent killer, and to prevent children from sharing food. So again, that could put children at risk of allergy, who've got allergies, intolerances, if they grab food off another child's plate or off a high chair. So it's thinking about, especially, where are those children sitting who have got allergies, intolerances? How are you making sure that they can't access food from other children? So really, really important you think about that. And then if a child did experience choking in your setting and requires intervention, really important that is recorded as an incident, probably on a first aid record form, and that parents are informed and aware, so you can look at that both together about how that can be reduced in the future. So there's a lot in that section. Like I said, a lot of it isn't new. It was already there in guidance. They've just brought it all together. So what I'd recommend is, have you talked that through with your staff? Have you reviewed what training staff have had around safer eating guidance, around allergies and intolerances? Have you looked at your ratios and the seating requirements at lunchtime? And have you looked at your paediatric first aid? Really good maybe to have a review of that. When's that, to make sure you know when that's coming up for renewal for staff, so you can make sure that that's planned and in place, so you're not getting to a point where you haven't got enough staff trained to cover that, to ensure that a member of staff is in the room at all times. So things to take away there for yourselves. So thank you, Kat. So this links in with the food nutrition guidance. The guidance obviously came out in May, and again, it's just asking practitioners to look at this guidance. It's now cited in the EYFS guidance from September, and what they're saying is you must follow that unless you've got good reason not to, and it sets out your duties about providing meals, snacks and drinks that are healthy, balanced and nutritious, and it does have quite a number of sections around how to promote safer eating and meeting those children's needs, support individual needs and other special diets. So next, thank you, Kat. So within that guidance, what they are saying that you should have a food and nutrition policy, and what they've done is they've set out what they recommend you include in that policy. So some of you already might have a food policy, a healthy eating policy. So again, don't reinvent the wheel, look at that and review it against this new policy, and ensure you've got all the key parts. And they're the key sections they say should be included. So it's about information about food and drink you're providing, how you're supporting if you have young children, how you're supporting weaning. Think about things like celebrations and special occasions. If it's birthdays, you know, do you allow parents to bring cakes and sweets? Does that meet your healthy eating policy? So again, that might be something you need to work with parents and make them aware that you don't accept that. Again, if foods are brought in, could that be a risk to children who have got allergies and intolerances? So it could be a risk. And again, that links in what Helen was saying about packed lunches and reviewing food that comes from home to make sure it's safe, and about that right information going out to parents. And then what are you doing around promoting children's needs around food safety and their needs? So worth looking through. Each section has a key takeaway information, so they're the things really to put into your policy. So it is well set out, and it's a very usable document with lots of hyperlinks and lots of advice and to support you with menu plans, how to support weaning. There's all sorts in there for you. So definitely have a real good look through the guidance. Thank you, Kat.
Joanna, just while we're on this, I just wanted to just pick up, there's a question that's popped into the chat before you move on to the next section. Just with regards to, they have an early years department in the school. The school covers 2 up to the age of 13, and the children eat in the main dining room on benches. 2 adults sit with the children. Should we look to have age appropriate related seating areas, or are you all right to just have the ratio of 2 adults with the children?
I think each setting needs to look at their environment and see if that meets the needs of their child. So some schools have settings have reviewed where the children sit, so have looked at where the EYFS children are. They're under 5s and thought about moving them and making sure a member of staff is sat with them. And some settings have increased staff to be in when them children are eating, ensuring they've got that paediatric first aid sat with them, first aider in the room at all times. So each setting, we can't say definitely what you've got to do and how you've got to do it. It's you deciding, looking at the guidance and then doing your own risk assessment. Would you agree, Helen?
I would, Joanna, but also I would just refer to paragraph 3.68 in the EYFS statutory framework as well, that says that babies and young children, and if we're talking your 2-year-olds here, obviously they are young children. 2-year-olds,
they've got to sit there on benches, aren't they? So they should be on appropriate seating.
They should be on high chair or appropriate size seating. It does actually say appropriate size low chair while eating. And it does say where possible, there should be a designated eating space where distractions are minimised. So again, just refer to the EYFS. There was another question just a bit higher up, Joanna, just about packed lunches and saying that even though they promote healthy packed lunches, sometimes, I'm just trying to find it again, sometimes parents, the packed lunches that they send in for the children are not always of the best sort of quality really to make it, and how can they sort of, I would again say this is all part of your partnership with parents to explain why it's important that children have a healthy packed lunch, and to use that guidance and to support. I mean, I know when I was in setting, we did have a healthy packed lunch policy that we gave to parents, and if things came in yeah, if things came in the packed lunches that weren't in line with that, we would like either speak with the parents directly or pop a little note saying, we've popped this back, we substituted it, we substituted your crisps for a banana or whatever, because the crisps don't fit in with our healthy packed lunch policy. So it is about, sort of being confident in your professionalism that actually what is right for the children, and sort of helping and supporting parents, to sort of understand that.
Yeah, and that's key. Yeah, that's what kind of the guidance is saying. It's about working with parents, and we know that's not going to happen overnight. It's about educating them, finding out what the barriers are, to providing that nutritious food in that packed lunch. And it's funny. I went to an Ofsted webinar around the nutrition policy and how they would, and that's what they would be expecting you to do, to have those conversations with parents,
Yeah.
and then work with them. And but like they're saying, it's not going to happen overnight. It's about your
Yeah.
key messages going out, your
Yeah.
policy, speaking to those parents individually, the little notes, giving them ideas. Because a barrier sometimes for parents could be financial. So does that parent need support to signpost to some services out there, like food banks and healthy foods, because there is an expense to some of that, isn't there? And so there could be reasons why, but it's just finding out how you can support parents, isn't it?
I think as well, I know settings I've been to, they've had, whether it's a display, where they've had photographs of different ideas of things to put in packets, in packed lunches. Some have even done sort of workshops, for parents, where they can come in and have a look at the sorts of things that can go in, and actually I think sometimes it's giving parents new ideas, new healthy
Yeah,
ideas of sorts of things that they can include in those pack ups, isn't it? Whether that's a
yeah.
display, a workshop, policy, or whatever that might be.
And affordable as well, because I think that's the
Mm,
key thing for a lot of parents. It is being affordable, isn't it? And some of is a cheap option, isn't it? So
mm,
sometimes that little bit of advice and guidance, and even sometimes they just bring too much food, thinking that they need
mm,
this massive amount, and actually portion sizes and quantity, and pointing out what's in that food, because sometimes it's empowering that parent with that knowledge. So it is difficult, and I think inspectors have recognised that's not something you can change overnight. It's about working with those parents, and like Kelly said, doing that display, giving information, putting notes, giving ideas, workshops. It is really difficult. So good luck. So next one, please, Kat. So that's all the no, I thought it was all the food safety, but there is one more I put in. So this is some top tips that are in the nutrition guidance. So I think this is a really good thing for you to maybe to go back and think about the new guidance. It really reinforces things you might need to think and take away. So again, the importance of what staff should know. They should know about special dietary requirements. Do they know about the plans for that child? If about administering that emergency medication, thinking about the food that's being provided in the setting, for staff even to think about food they might bring in for activities, for art activities, for play activities. Could that be a risk or a hazard to other children? Few schools I've gone into, they've done movie days and they've had popcorn, which is a no from the DFE and the Food Standard Agency for children under 5, because it is a huge choking hazard. So they've had to rethink that. So again, go through that, and think what are you doing in your setting around to reduce those risks, and do staff know these key areas around keeping pupils safe around food, and your policy around promoting safer food. So are they bringing in cakes and sweets to give the children, and is that giving them mixed messages, what your policy is saying? So it's just making things clear so food is safe, and that staff are well trained and got that awareness about the risk around food for young children. So that's the end of the food safety. The last slide, last two slides for me. The next one is around children's privacy. There's only one extra part, that bullet point that's been added into the toilet and intimate care hygiene section, and it's about providers must ensure children's privacy is considered and balanced with safeguarding and support needs when changing nappies and toileting. So with this, you need to think about, we're teaching children pants is private, but sometimes in settings we've got children that have to be changed in front of other children because of the nature of the setting. We have children that maybe come out the toilets to get assistance and support with their knickers down and exposing themselves. So it's really important that we start from a very early age to teach children that pants are private and encourage them to have those good skills in place to promote their own privacy. So encouraging children not to come out the toilets undressed, for closing doors, and when you're changing, think about, you know, it's about balancing your safeguarding and protecting that yourself and that child when changing and assisting with toileting, but it's about that really enforcing privacy. So it's great that there's a member of staff in the area, but it shouldn't be really seen by other children, because again, like we say, it's giving mixed messages which could put children in the risk in the future of those mixed messages around their body is private to them, and shouldn't be seen by others, and then we are changing them in front of other children. So just maybe think about that in your procedures and staff training. So the last slide, next one, Kat, is around safeguarding training. So now within Annex C, there is a criteria that sets out the criteria for effective safeguarding training. So the Annex sets out the training requirements for practitioners, childminders and childminder assistants. And what they're saying quite clearly is that training should be completed every 2 years. Providers and childminders may consider where their staff may need annual refresher training to keep up to date with key updates, or resulting in concerns or issues that are happening, or maybe, like Kelly said, contextual issues. So again, this training tonight could be used, these slides, to go back and deliver with your staff to keep them up to date with key changes around safeguarding and food safety training. That could be there to keep them up to date. For a designated lead safeguarding lead, they must attend training every 2 years, consistent with the criteria in Annex C. So there's quite a lot of information in the Annex C for you to look at. And again, that training must be every 2 years. What they are saying is that that should be consistent with the messages from the North Yorkshire Partnership. And on their website, they do have a section around what training is available to designated leads and staff. So there's a wealth of training on there. There's a wealth of free webinars, free e-learning. NES deliver training for designated leads. There is a cost for that, but it's really important that if you're a designated lead, that you do complete the early help and child protection referrals training, because that will take you through, if you had a concern around a child, then how would you access support and complete a referral. So definitely look at that site. There's also the YouTube channel where this video goes on. There's a wealth of additional training on there that you could access and use with your train, depending what's needed. So Kat's put in the link there, so definitely look at that. It also says in that section that all practitioners, childminders and childminders assistants should read What to Do If You're Worried a Child is Being Abused. So that's a really good DFE guidance, and that sets out the categories of abuse, what is abuse, and signs and indicators. So that's a really good document for staff to read. And it's also good practice for setting staff to read Keeping Children Safe in Education Part 1. There's a shorter version, and we'll make sure that gets sent out in the next briefing. That again sets out what abuse is, what to do if you're worried about a child, whistleblowing, concerns about staff member, or concerns where you've got concerns about the setting and their safeguarding approaches. So it's a really good document, again, to give them a good overview and a refresher. And I would say if you get staff to read those once a year to keep them up to date, record that they've done that, get them to say they've read and signed that, record a register to say they have read and signed, because it's good evidence to keep them up to date and a really good refresher. But like I say, there's a wealth of training on the North Yorkshire website and on the YouTube channel that you can access, and then there is going to be some further training from Kelly and I. So thanks, Kat. Please, last few from us. So these are just some useful documents for you to access all the documents we've spoken about today. And that what video at the end is the food safety for young children, the 3-minute video that you can use with staff to just update them on how to prepare food safely to prevent choking. Thanks. So as Kelly and Helen spoke about at the beginning, and we've talked through about some training from ourselves as part of the offer from the local authority. So there are going to be some free webinars available, and we'll make sure that comes out through your normal channels so you know where to access them. So Kelly's put a session together about managing low-level concerns in a setting and what to do, and some recording forms that'll be coming out. I've done a session on Martin's Law, the Protection of Premises Act. This is something new coming in for schools and childcare settings. And so I'm just going to, the session I've done is about giving you an overview of that and what you need to do with a setting. It's not too onerous for nursery settings. It's all about your site security and your emergency procedures. So that's going to be available. The LADO has a free webinar that you can access around managing allegations against staff. And again, you can use that with staff, so that's freely available. And then the DFE are offering some prevent training that they put together specifically for early years settings. The only thing is it's like 4:15, I think 4:15 or 5:15 on an afternoon, so it's not great, but maybe we can feed back to them, because they maybe do a couple in the evening. So we'll make sure that comes out to yourselves. So they're the ones that we've kind of, Kelly and I and Helen have discussed. What we kind of want to know tonight, after we've done this session with you and around the key changes, what further webinars would you find beneficial? If you want to put some ideas in the chat, that would be really helpful for us to go away and produce them for you around your needs, really. Instead of us thinking this is what you need, it would be better for us to help where you think the gaps are. So for an example, you might want something on managing attendance, as that's new for settings. So that's something we're happy to do, or something on recording. Again, that's something we can do. Again, they would be brief webinars, 20 to 30 minutes, with resources for you to take away and use. So put any ideas in the chat, or drop us an email afterwards and let us have some ideas, then we can put something bespoke together for yourselves. So I think last one, Kat, I think it's just our thank you and questions. Yes, it is.
Can I just add there as well, Joanna? Someone's just asked in the chat where they would get the pre-recorded webinar. So I've just put our link to our page in there. So we've got Joanna and I've got a safeguarding page. Well, I thought I'd put it in there, but it seems to have disappeared. Oh yeah, it's there. So the plan is we will upload them to our safeguarding page, where we have other training available for settings. So we'll make it really clear, as you know, these are the pre-recordings for yourselves, and then obviously you can access those for free.
Yeah, they're not there yet, but hopefully they'll have something by the end of the week on there. Yeah, so we've recorded a couple.
Yeah, and I say this is all part of this bigger support, along with those training courses that are already available that John and Elaine will be delivering. You know, there's the Understanding the EYFS on the 9th and 16th as well of October. There were just a couple of other comments in the chat bar, which I think between us we've probably covered. A bit about, obviously, about fussy eaters. I put the NHS link there. Kelly's put the DFE website and the information that is there, and I can't stress enough how actually I do think that DFE website is good. It does have lots of useful information and links to it. And then I just posted what I'd put in the last key messages of the 1st of October. And that's our HDFT. Obviously, HDFT deliver health services for the whole sort of county, not just for Harrogate. They are the the delivery partner, and they've got an app now, and they're also running fussy eater workshops for parents and providers. So that was in the 1st of October's key messages, but I've put it again there in the link. And then I know it says about basic level 1 safeguarding. And
There's
I mean,
designated lead
Kat,
training question.
what I put was that obviously there is that online basic awareness training available on the Safeguarding Partnership website, which is always there. Kat, would you say there was, would that
That's
suffice for
that's the
suffice?
link
Yeah,
for it's like a basic breeze training. I don't know if it is level 1 off the top of my head, Helen, but it does have a good kind of basic understanding of safeguarding. It's one that you can kind of use with your staff, and it is a free link as well. So even if you just need to do a quick kind of refresher of some of the key points, it's there.
yeah,
Yeah, and level 1
absolutely.
is usually just the North Yorkshire doesn't level them. We just call it
No,
our basic, but other local authorities and Ofsted do call it level 1. So it is what a level 1 is, that
yeah,
childcare.
yeah. And then
Someone's asked
Claire,
about the designated lead, best training to do. So I don't know if they're a childminder or a nursery manager, or because that might be different. Would
well,
it be Helen?
also there isn't any specific DSL training. I think it's looking at what Annex C says in the EYFS statutory framework, and obviously, you know, your 1 and 2 is what all of your staff should be aware of, but then your part 3 are those extra bits that the DSL. So it's just about you making sure that you're accessing the information from the Safeguarding Partnership website. Obviously, the North Yorkshire one, because we've had providers in the past that might have accessed leads and things, and then when the Ofsted inspector's gone and said, "Oh, you know, share with me your local Safeguarding Partnership procedures," they've shared leads, which obviously, you know, we're not leads. So it's looking at what it says in that section, paragraph 3,
Yeah.
and making sure that you've got your safer recruitment, and you know that you know how to refer into MAST and how to refer into the LADO and all of those kind of things. And even this is part and parcel of your ongoing safeguarding updates, really.
I mean,
Um,
you can purchase training through North
yeah,
Yorkshire through Enya. So there's
Yeah.
someone called Alana Miles who
yeah,
we recommend to schools if they're doing DSL and deputy DSL training. So that's called, I can put the link again in the
Yeah, I was
chat.
going to say, so
Early
we've got the
help.
chat in.
Yeah, I found it actually. I'll do it in a minute. Early help and referrals, and then there's the signs of safety conferencing pathway. So obviously there's
yeah.
a cost involved in those, but then that is, you know, we would advise our school settings to do basically that training, and that they're fully fledged DSLs then, but obviously there is a
Yeah.
cost for those.
And
And what
obviously,
it,
like Louisa said, if you want to access external training, you can do.
Mm.
Legally, companies are not allowed to call safeguarding accredited. Safeguarding training is not allowed to be called accredited because it has to meet statutory requirements. It's not negotiable. That's why it's not accredited. But obviously, there are companies out there doing safeguarding training, which is absolutely, perfectly, ticks all the boxes. So yeah, absolutely.
and in that Annex
Just
C, it does actually specify that one of the elements of the training must be that local child protection procedures and how to liaise with the local
Mm.
statutory children's services agency and the local safeguarding partners. So if you're accessing, like Helen said, accessing training from another provider, that's fine. But it's that, like you said, when Ofsted come, they want to know, and for the safety of children, you need to know who to go talk to in referrals. So the one that
Yeah.
Kelly's shared, there is a cost, but that is I think it's a 3-hour course, isn't it?
Yeah,
So it's
put
not
two,
a
there's
massive
two
cost, but
courses. Yeah.
yeah. So at least the first one, you'd know how to refer and how to access
Yeah.
early help. And the next one is an additional where you'd learn about core groups and conferences. So,
Mm.
yeah, it would say it's quite key that you do attend something because that
Yeah.
is what they're specifying in that section.
Maybe the
Yeah.
first one's the better one for
Yeah,
the early help and the
yeah.
referrals. I've also put the link into the partnership. They have a training page as well. So you can see the little brain picture. That's obviously they've got all their training on there.
Just
Yeah.
in
And then
relation to the comment on the bite-sized learning as well, it is something that we've picked up as from a partnership point of view, and we're going to look at putting some shorter videos up as well. But just a little tip, obviously all of our previous videos and all of our recordings that we've done for the early year sessions, like going back over the last couple of years, are on the YouTube channel, and I will put the link in the chat. But what we've started doing, and I'll probably try and go back and do all the previous ones as well, is we do chapter the videos. So what you can do is you can look on the first couple of slides, look at the agenda, and then you can click, there will be a link in the chat that will take you to that chapter of the video. So going back to something that Kelly mentioned earlier around kind of contextual safeguarding in early years, we had one of our contextual safeguarding leads come to a session last year, didn't we, Helen, who did a really interesting session around some of those signs and things to be aware of from a contextual point of view as an early years lead. You can go back, and that's probably about a 10-15 minute presentation. So there's your little nuggets of bite-sized learning. It's just finding them on your YouTube channel. So I'll go back and make sure everything's chaptered, and it's just easier. And then you can just click on the link in the video, and it'll take you to that section. You can play the right section.
someone else put a question about childminder, that they attended childminder training. I think that was for Alana Miles, and is that okay as designated lead training? So that was some bespoke training, wasn't it, Helen, that Alana did for childminders? So that meets the criteria for childminders.
I was going to say, absolutely. If I mean, I don't know exactly what Alana, but I mean, Alana is you know, a senior training provider for safeguarding. So if it was the dedicated childminding safeguarding training that she put on, it would have covered everything from basic through to what your responsibilities are as a DSL, which you know, childminders have always been their own DSL. It's just the wording that has been tightened up by the DFE to bring it more in line with everything else. But you know, it really is just going back to what it says in that Annex C, paragraph 3, and making sure that you know exactly, you know, there's different bullet points that actually, how do I do that? How do we do this? Have I got those numbers? How would I make that referral? And the other one is obviously the internet safety as well. And I've just put the LADO number, just again, make sure you're using the updated LADO number, and there's a LADO notification form as well, which you can download from
I've just put a link to the page, and there's posters and all sorts on Marie's page. There's posters, there's training leaks, there's the form, everything.
Yeah.
Someone did have their hand up, so I don't know if that's gone down or we answered their question or.
Lovely, thank you, Claire. My insurance company provides training. Is that enough if I also do the links you've posted? You can do safeguarding training with anybody as long as it covers, you know, the safeguarding. What the crucial bit is, as Joanna said, is making sure that your information relates to the local safeguarding partner, and the local safeguarding partner in North Yorkshire is the North Yorkshire Safeguarding Partnership. And so it's what we have on our website, the links that we have there, the links into MAST, all of, you know, the LADO numbers. The generic safeguarding is fine. It's then those finer details about who do you go to, where do you go to in North Yorkshire if you needed to contact LADO. And that's what a generic one just won't give you.
So it's probably fine to access that generic one, but then doing maybe an add-on to make sure you do know all the local processes. And that's coming what some of our schools do. They might access something through another company, but ever so often drop into that child protection referral sessions to make sure they're keeping up to date with local processes.
Yeah, someone's asked about training with other counties. Yeah, you can access training, you know, through other counties as well. Obviously, we're the North Yorkshire partnership that we've just quoted on here with the different links. But yeah, all counties have their own partnerships as well, so they'll have their own training available and their own LADOs, so you can, and their own mass teams, the social care team, so you can access their information through their partnership website.
You can, but please make sure that all your policies and procedures refer to North Yorkshire
It's maybe sometimes settings are close to the border. So we
Exactly,
often have that,
exactly.
yeah. So
Yeah,
if they've got children
yeah,
at a different setting, I
yeah.
suppose,
It's
sorry,
yeah,
different,
exactly.
yeah, an address in a different county, then I suppose they would
Yeah,
need to access. So I'm
yeah,
guessing that's what you mean. Yeah.
yeah.
Okay, thank you so much, Joanna and Kelly. I'm conscious of time and I know we want to get people away for 9 o'clock and get the other bits. Kelly and Joanna, I wonder if you want to just put your email addresses in the chat as well, because and it's just a reminder that you guys are on hand and can kind of take any of those questions out of the session as well. But huge thank you. There was so much information there, and like I say, you will get the slides. What I'll do, I'm conscious that there's loads of links that have gone in the chat as well. I will put an email together with the slide deck and all the links that we've shared in the chat, just so you won't lose anything. You've got it all to hand. Okay, so just for our next part of the agenda, I would like to welcome Angela. Angela, are you with us, or are you still singing in the choir?
Hello, yes, I'm here.
Welcome, Angela. Right, I will hand over to you to do your session on meeting the needs of early use children for military families. Thank you.
But you can go on to the first slide then, Kat, and I'll start from there. Thank you for having me. Good evening, everybody. So I am Angela Campbell. I'm the Service Children's Champion for North Yorkshire Council. And in my spare time, I run a choir, which is why I'm a little bit late to the party this evening. But basically, my role is sort of gaining a bit more profile at the minute. More people are hearing about the work that I do and why it matters. And so this is another really good opportunity for me to reach out to nursery settings, early years settings, private and voluntary, to let you know that I'm here, really, and I'm available to support you. So anyway, my role was created in 2012, and over time it has changed. It began with mainly one-to-one family support, but over time we've been able to increase our reach and our impact by offering a website, lots of resources, lots of events, and I'll go on to talk about that as we go on. The reason I do this job is because I have lived experience of military life. So it wasn't my parent, it was my husband who was in the army for 24 years, 3 children, and I was a full-time teacher as well, trying to manage and keep everything going. So I used that experience of bringing up my children, of dealing with the impact of military life to support children, families, schools, and other professionals. There's 3 main areas of work that I focus on. One is advocacy, which is huge, about raising awareness of the challenges that they face, increasing understanding of what service children go through. And I also do lots of events and workshops and direct work, which I try to do as often as I can because I still need my fix of working with children. So in case you don't know, a service child is somebody who is from an armed forces family. It can be that the parents are serving now. It can also be that they were in the past and they've recently come out. So once they get to primary school, we call them, they still get EVA 6, still qualify. And obviously we have lots of veterans in our country as well. And we have lots of people who are in reserve services as well. So it's a big and a growing picture. And often our service children go under the radar. And that's a little bit of why I'm doing this job. So if we can go on to the next slide, Kat, please. So why does it matter? So I ask this a lot, why is it any different for a service child than it is for a civilian child? And the reason is they move a lot. Okay, so if I use my lived experience, we moved every 2 years to 18 months even. We lived in 6 houses. My eldest child went to 6 different schools. By the time he was in year 6, if you weren't moving, there was constant disruption to routines, to schools, friendships. They were constantly having to adapt to new environments. They made attachment with key workers, for example, and then I'd have to move nursery and they'd be in a different area completely. So again, it's that trying to help them cope with that constant and frequent relocation. On top of that, you then also have parental separation and deployment with long periods of time where a parent is deployed. If you don't know what a deployment is, because it's all strange language when we start talking about armed forces families, but deployments often are 3 to 6 months long. They're often in a different country. Often communication is quite hard. Time zones are different. All these things have a huge impact on the home, and it can cause anxiety, confusion, and emotional withdrawal in some of our children. Our very young children, which obviously we're talking about tonight, might not fully understand where their parent is or why they're absent, and it can lead to behavioural changes, which is probably sometimes the first time you notice that something different is happening maybe in the home. The military life can cause, and believe me, I know this one firsthand, it causes a lot of emotional stress and uncertainty. It was really difficult because you would be having conversations with your husband, and although we think little ones don't listen, we know that they actually do. And they would pick up half of our adult conversations. They would pick up words like war or danger or moving or posted, and they often wouldn't then ask you about that. So it can lead to more stress because they're worrying about something that they're not certain of, that they don't understand. So when they're going through periods like that, we see these children becoming more clingy. Perhaps they're not sleeping as well as they used to, or perhaps they're going back a bit in their behaviour. My children often went back to, they'd have been dry in the night and they go back to not being able to get through the night anymore. My eldest daughter, even when she was 12, would struggle to sleep when Dad was away because of the anxiety and the stress that goes with that. Next slide, please, Kat. I feel like it's COVID times and we're back doing that again. And obviously, before I did this role, I was a teacher, as I mentioned before, and there is such an impact on learning for these children, especially early learning. Moving between settings, it really does create gaps in learning. It can lead to inconsistent supports. So for your developmental milestones, there can be a lack of continuity in care. So if they've been undergoing speech and language courses in one county and they've moved up here, it's a whole thing of trying to start everything again. It can really affect their confidence as well. As they get older, it can really impact them in terms of their English and their maths learning. They might have just done division in one school and come to the next school and they've already covered it and they're not going back onto that bit that they need to do. So it has a knock-on effect. What I really do find is they struggle because sometimes they feel that they are different from their peers because of their family's lifestyle. So it's about helping them to feel integrated and making them feel part of your community. They may struggle to explain, especially when they're very young children, how they feel different or what experiences that they're going through. But you might just notice them feeling that way. I know my son struggled to make friends in nursery and he was really mostly playing on his own. He was a very shy boy, didn't really engage with the others because he'd moved so often. So I think he felt probably that it wasn't worth making friends because he would have to say goodbye to them again before you know it. The big one for me when I had my children and they were all under 5 years old was that limited access to extended family. I was the other end of the country. I was down in Hampshire, my family up in Liverpool. I didn't have mum round the corner or an auntie down the road or not even within an hour's drive. It was a 6 to 8 hour journey to travel back up with a baby who I was trying to breastfeed and would scream from London all the way up to Liverpool. So you would then put off coming back to visit because you knew how stressful it could be. And obviously when you're learning to be a mum, when you're learning to be a family, you need to be close to those extended family members because you have that informal support network that help you. And lots of military families, they just don't have that. So they're relying on friends or neighbours. And it really does knock your confidence as a new mum, I have to say. Not everybody would be in the same boat as me, but for me it did. Things like going to coffee mornings were daunting. I just didn't want to go. It was easier to stay in my bubble with my baby than it was to try and go out and make friends. So it's really important that we're thinking about this with our families that we're working with. So it's not just the child that I want you to be watching out for. I actually also want you to be watching out for their parents. you know, and really trying to engage them and make them feel part of your community. Just having somebody who says hello to you each day, believe me, when you're lonely, when you're in a new area, when you're struggling with little ones, having the key worker. I had a fantastic one in Manchester who made such an effort every day to ask how I was, was my husband away, and did I need anything, or don't worry that you've forgotten. I had a completely different experience down south where they never asked, they weren't bothered. And that made me feel like I didn't matter, I was invisible. So really think about that for me. Okay, next slide, please. So what are our key needs for service children? Our service children just want to feel like they belong somewhere. You know, their lives are so chaotic. You know, things change all the time. They move house all the time. They move changes of uniform even really annoy them. You know, the changes of texture of a jumper. And sometimes people think, well, perhaps they need less structure. We just need to let them find their own way. What I find a lot of the time is what they really want is routines. They want familiar environments. They want to know what's happening. Having a consistent key worker makes all the difference. They need emotional support. Try and recognise when they're withdrawing a little bit, or that they're appearing more anxious than normal. Using, obviously, you will all be doing this, but emotional check-ins, using storybooks. We can't pass that by. There are fantastic books like The Invisible String or My Daddy's Going Away, Ruby's Worry. There are tons of books out there that, whilst don't have a specific military theme, are a fantastic way to bring up those discussions about missing somebody, or still feeling connected even though you're not together. And obviously play therapy is going to be really, really important. I think it's incredibly important that children feel proud of who they are and the families that they come from. So I would really like to do a bit of a call to action, if you like. In your setting, do you mark things like Armed Forces Day or the Month of the Military Child, which is April, by the way? And if you don't, if you can visit my website, which I'll put in the chat, there's loads of resources, loads of ideas, loads of ways that you could perhaps incorporate that into your setting and start considering those military families in your care. And I came across something special the other day and I really wanted to share it with you. And while it is American, there are some fantastic little videos. So there is a website called Sesame Street for Military Families, which is obviously being developed to support the US forces. However, they have fantastic little videos with Elmo, and it's all about missing somebody, about reunited, about looking forward, about asking for help. So there were some lovely worksheets. There was all kinds on there. So it's worth a little look. So that's Sesame Street for Military Families. Have a look. It might come in useful. Next slide, please. So in terms of some practical tips for you, for me, it's all about communication. That is the most important thing that you can do, is to build a strong relationship with the parents and carers. You can build it with the parent who perhaps is the non-serving parent, who is probably the one who's picking up those children every day. You can absolutely do that face to face. But also think about, how do you reach out to the parent that perhaps is away? So do you have a mechanism to do that? Some schools use things like Class Dojo or Seesaw as a way of creating a photographic journal almost for parents, so that when they are ringing home from Kenya, they know what's happened recently in that little one's life and can talk about it with them, or can say how proud they are. That really helped when we had those awkward conversations where Dad would ring and it would all be a little bit stilted, and the children aren't usually ready to talk because they're tired or they've just had the tea, and he would be able to go, but I know that today you did so and so, and that was a really good way for him to get the children to talk to him. Try and support your children during transition time. Do you have a welcome pack for your military families? That signposts them to other groups and things in the area that might help them feel more integrated. Do you have sort of a buddy system maybe with some of your older little ones, if that makes sense? Have you ever delivered any staff training on this? Are your staff aware of the impact of military life and, what we can do to support military children? If you haven't and you would like access to some training, hello, and that's my role. So you can get in touch with me and I'd be more than happy to deliver some training for your staff, or provide you with the resources that you need to do that. There are lots of resources available for you. So there is my website, first and foremost, servicechildren'schampion.co.uk. I know that on the NYES site, there is some 1-minute guides on military life as well. Little Troopers, I wanted to give a shout out to. That's a charity that do fantastic resources for all different ages of children. But what I really like is they offer role play costumes and resources and storybooks for early years children. So it's worth checking out Little Troopers. And then the last bit is a link for you. When you go on that, there is some really good training that I've come across about understanding children from armed forces families. So rather than me go through that training, I've put it in as a link for you to have a little look at in your own time. Okay, and I think that's nearly me. The last one, final thoughts. So meeting the needs of early years service children means recognising that they do face challenges. And whilst I don't want you to go in thinking, oh, poor you, or poor, what a terrible life you have, it's also being aware of those things so that we can navigate them with the parents, and actually making children proud that they're resilient, that they are coping with these changes, or we're teaching them skills to cope with these changes. They do face challenges like mobility and separation and stress, and we need to respond with empathy, with consistency, and by connecting. And I think by creating that stable environment for them, bringing sort of building that really strong relationship with families, celebrating who they are whenever you can play a vital role in helping the children thrive. It doesn't matter whether that child is with you for 18 months or 2 years or 6 months, you need to make them feel like they're important. And if we can all work together, we can ensure that every service child feels safe, supported and valued. And that's it from me for now, because I know that people will want to get away. But what I will say is, please do feel free to reach out to me. I'll put my email in the chat as well. And I'm happy to answer any questions or in the chat. So I'll hang on for a little bit as well.
Yeah. Thank you, Angela. That was a really helpful presentation. If I can just direct you up, there are a couple of questions in the chat.
Okay.
I'm conscious and I want to get people away for 9 o'clock.
Okay, I'll answer those then.
So if you want to have a reply, either pop a reply in, or like I say, if you pop your email in the chat as well, I'm sure people are more than happy to contact you directly. But yeah, thank you so much, Angela. And we will move on. Sarah, are you with us?
I am. Hello.
She's here. Yay. Well, yay. Right. Okay. Our final slot on the agenda. I'm really pleased to welcome Sarah Stansmore, who is our designated nurse for safeguarding children. Over to you, Sarah.
Thanks, Kat. Evening, everybody. So the last slot on the agenda is perplexing presentation and fabricated and induced illness. It's not a light topic, really, is it, for the last one? But it's a really important part of safeguarding, and one that we just thought we'd spend half an hour talking through. Just pop the next slide on there, Kat. Thank you. So over the next half hour, I'm hoping that you'll get an increased understanding of fabricated and induced illness, and just to be mindful that this used to be called Munchausen's by proxy. People are probably going, yeah, I know what you mean there. The terminology changed quite a few years ago to fabricated and induced illness. It just sits better. It makes more sense. So that's the terminology that's used and recognised now. We're going to consider the guidance that we use when we're looking at this type of safeguarding. We're going to look at roles and responsibilities when involved in a case of fabricated induced illness or perplexing presentation, and when we need to make a referral to children's social care. And it might be that you're working with a family where there's a sibling there's concerns about fabricated and induced illness, or the child you're working with is concerned. So it's very relevant to all of us, really. And a big part of the changes in guidance is around the health and education rehabilitation plan for perplexing presentation and how we manage that. So again, I'll talk through that. Thanks, Kat. So this is the guidance that we use. The new guidance came out in 2021, and this allowed us, it gave us a new category. So prior to this guidance coming out, we'd talk about fabricated and induced illness, and that was it. So if there was a case where we were a bit confused about why this child was repeatedly coming to services, was repeatedly being presented at different places, medications didn't seem to be working, it was perplexing. We didn't really have a category for that, and it would just be considered explored as fabricated or induced illness, which really is a bit of a jump. So the new guidance factored this in, and it gives us the it allows us to consider perplexing presentation, to have those conversations and discussions. Prior to this guidance, fabricated and induced illness was quite secretive almost. It was felt that if you spoke to family about it, potentially if somebody was harming a child, their knowledge that it was being explored might put that child at risk. They might increase their behaviours and do something to harm the child. But actually that made it really difficult. It made it really difficult for families. It made it really difficult for staff. And it didn't really foster the culture that we have about being really open and honest with families and having conversations. And it was recognised that the majority of cases that sit under this umbrella are actually managed much better if we through communication and conversation and getting a shared understanding of why this child is presenting to services. It might be around mum being really anxious, and actually a conversation can allay those fears. It could be around there's a perceived belief they'll get a financial more benefit or something if this child is diagnosed with a condition. So there's a push for that diagnosis. It's around explaining to the family what's best for the child, what this means for the child, but really understanding and allowing us to have that conversation is really the best way to go about things. So that's our perplexing presentation. So over the next few slides, I'm going to try and give an example of perplexing presentation. Then I'm going to give an example, sort of a case study of fabricated illness, and then an example of induced illness, just so you can see the continuum. Obviously, the majority sit within perplexing presentation, and that's good. Obviously, that's the least risky, and the one that can be managed much more easily with communication with families. So next slide, please, Kat. So that's the definition of perplexing presentation. It's the term perplexing presentation was introduced in the guidance to describe a commonly encountered situation where alerting signs of possible FII, not yet amounting to likely or actual significant harm, and when the full state of the child's health is not clear, but there is no perceived risk of immediate harm to the child's physical health or life. So that's the important thing around this element, this starting point for us. Next slide, Kat, thanks. So case study 1, perplexing presentation. So a secondary school age child with a number of confirmed and reported health conditions have a number of confirmed and reported, and it's as a result this child's been away from education for some time. The child's under the care of a consultant at the local hospital, yet the frequent attenders at unscheduled care settings, seen in various different settings. Mothers advise school that they need to place significant restrictions on the child's activities in school that would stop them accessing the full curriculum. But the school are not confident that this level of restriction is required. So they're really quite confused around why mum is asking them to do this. They don't understand. So what's going to be their next step? Next slide, Kat, thanks. So the next step would be a conversation with parents. First and foremost, school sitting down with I'm saying mum, and I do use the phrase mum, and we know that in the majority of cases, research tells us that it is the female carer that presents when we've got perplexing presentation or fabricated and induced illness, but that's not to say that fathers can't present as well. It's just we know that the majority are mums. So with parental consent, so open honest conversation, the school say, we just want to understand, we really want to know how we can support your child in school. How are we best going about that? Can we contact the paediatric consultant so we can have a conversation about how we're best supporting them in school? So that would be the ideal. Sit down with mum and dad, and they give their consent. They contact the paediatric consultant. And what would happen, the expectation would be, as outlined in the guidance, that the paediatric consultant would coordinate a professionals meeting to get a full picture of the strengths and concerns, again with parental consent. So they'd be contacting everybody who the child has contact with. So that would be education, that might be a physiotherapist that's working with them, anybody at all that can sort of contribute to this conversation and get a better understanding of this child's health. So from these conversations, it appears that there's no immediate concerns, but it's still really unclear why this relatively low level health issue are impacting on the way that mothers reporting. So what we agree to do in these cases is that this is explored and monitored through a health and education rehabilitation plan. So again, this was new for the 2021 guidance, and it allows us to come together with education to. At this point, we haven't, social care aren't necessarily involved, and that's absolutely fine. If they were already open to children's social care for another reason, social care could be involved in this plan. And again, that would be totally appropriate. But the referral hasn't been made to children's social care because at this point, we haven't got a significant risk of harm for this child. We're just trying to explore their perplexing presentation. So next slide there, Kat. I'm trying to remember what's on the slides. I was hoping it was this one. So the health and education plan is something it's collaborative working. It's working with multi-agency partners, working with the family and the parents. It's really important that they take a role within this plan. So the plan is led by one agency, and that's normally health. That would normally be the child's consultant, paediatric consultant. It would involve education, possibly social care, as I've said, and it's really important that the GP is part of this. The GP is the cornerstone of health information. So if this child is being seen in a clinic in Bradford, the GP would receive that information. If they're seen in Manchester in a specialist unit, the GP would receive that information. It's a central point, so it's really important that the GP is involved in this and aware of this health and education plan. It needs to be really specific with timescales and intended outcomes. It's really important that it's tight and people are clear about what their roles and responsibilities are. And it needs to be agreed who in the professional network will hold responsibility for coordinating and monitoring this plan. If parents disagree, or there's a lack of engagement, so it could be that the parents have agreed, but actually they're not turning up for meetings, we're not seeing a change, child's still off school, we're not seeing any meaningful engagement with this plan to improve the health and well-being of the child, then a referral to social care may be required at that point. But that would be through discussion with the group members. Moving on, Kat. So we've talked about perplexing presentation and how that will be managed on a local level, talking with families and bringing health professionals together. And we're moving on to fabricated and induced illness. Next slide. Thanks. I'm not going to even attempt to read this. I'm going to let you all read it. I tried to read it the other day and it's a tongue twister, but it's the definition of fabricated and induced illness. It's a bit of a mouthful, particularly at this time of night. So I'll just give you a minute to read through that. It's taken directly from the guidance. I think that'll be about right. Are you all right to move on there, Kat, if everyone's had a chance to read that? Thanks. So how can fabricated and induced illness present? So we've talked about perplexing presentation. We're now worried about illness being fabricated or induced, so caused. So it could be a parent is reporting signs and symptoms that are not explained by any medical condition from which the child may be suffering. Physical examination and the results of medical investigations don't explain the reported signs and symptoms. There's a poor response to prescribed treatments or medication, and this is something we've seen in practice quite a lot, and it could be something as simple as constipation, and a child is being brought back to the GP or the paediatrician with constipation, medications being prescribed. Parents are adamant, or mum's absolutely adamant this has been given exactly how it should be. The child's on the maximum dose, but it's having absolutely no effect. That's becoming it's now becoming unclear. Why is this? If this should be working, why isn't it working? We know that it's based on parental reporting. Is this right? We start to question if this medication is being given in the way it's being given, the way it's being described. New symptoms are reported on resolution of previous ones. That's something that we quite often see in practice. And a child's normal life activities are being curtailed beyond what we'd normally expect for any medical disorder. And over time, the child is repeatedly presented to different health settings with a range of signs and symptoms. Now, this one's really important because as these concerns progress, parents will often go elsewhere for treatment, for an opinion. And when we get to an end stage, we can sometimes have a family a child who is open to multiple health professionals in all sorts of different areas, making it really, really complicated and really, really difficult to get that collective view. There might be somebody in Leeds, a paediatrician in Leeds. There might be in a specialist gastro unit somewhere else. But it's just sort of making that process more and more complicated to understand. We sometimes see symptoms and signs that never begin unless the parent or carer is present. So we could have a child that's been admitted to the ward for a week and none of the symptoms that have been described have been seen over that week. And then they start to happen again when that child's discharged. And we might have inconsistencies between the seriousness of a story and the actions taken by parents. So examples from practice: a parent reporting that a child stopped breathing at home and went blue, and however, after a few minutes she came round and they went on with their evening. That doesn't ring true. That would be really, really concerning. It's not proportionate. We'd be really worried if that happened. We would expect a parent to be really worried and seek some help if that happened. So just inconsistencies around stories. Thanks, Kat. So case study 2 is fabricated illness. So fabricated illness is just that. It's when we're concerned that things have been made up. Concerns raised by health services that they're unable to find information to confirm a child's alleged complex health needs. So education. Mother has informed school that the child has complex medical needs and is undergoing treatment, and has actually shown school appointment letters. Hospital. The local hospital have said, yes, the child's attended for routine outpatient appointments, but there's no evidence that this child has complex health needs within their records. The GP is asked. There's no contact with the child, hasn't had any contact for a while, and is unaware of any ongoing health needs. And as I said, the GP is the cornerstone within health, would hold that information, those discharge letters. And hadn't received any letters, was unaware that this child was allegedly under the care of hospitals, a number of hospitals, and social care were contacted, no previous involvement with this family. And just move on, Kat. Thank you. Further information came to light that mother had advised school that the child is unable to attend now due to the deteriorating health. Mother states that the child may need a wheelchair due to reduced mobility, but school is saying that's not their experience of this child. And mother reports that the child's under the care of a specialist team from out of area, and they've attended 2 local hospitals for treatment. So really, really adamant and standing by the story around this child's health. Thanks, Kat. So what happened in this case? Well, the lead consultant, so in this case, the child wasn't under a consultant. If the child was under a consultant, it would be their named consultant that they were already under. This child wasn't under a consultant. So the named doctor for safeguarding children, who's a paediatric consultant within a each hospital has one, took responsibility for sort of coordinating this to really get an understanding. Obviously, we're starting on Perplexing presentation, aren't we? So we need to understand what's going on with this family and gather some information. So from this information gathering and contacting the hospitals that the child was allegedly receiving care from, it became apparent that actually the child wasn't under their care. And it became quite worrying, particularly around the appointment letters, because they'd been shared, they'd been seen. So there was a concern that there's some deception here in terms of that the letters were fabricated. This resulted in, because we were concerned about fabrication, this results in a referral to children's social care, and a strategy meeting would be held. It would be agreed in strategy what would the next steps be, and that's to have an open and honest conversation with family. But when we're at this stage, we'd agree that within the strategy meeting, when are we going to speak to family, who's going to speak to them, and how should we do that? Open and honest conversation with family was held. So this case was progressed through child protection procedures due to the level of concern and the emotional impact this was having on the child and siblings. So this child wasn't under the care of any consultants, didn't have the medical condition that mum was saying they did, didn't need to stay away from school. Harm hadn't been induced. However, there was an emotional impact because the child's activities had been curtailed, and the child thought they were ill. The child did think that they were unwell, and they weren't. So this case was managed under our statutory safeguarding framework, under a child protection plan. And during that time, mothers' beliefs were explored. It was supporting the family and reducing the risk of harm on the child and sibling, to get an understanding of why this happened, and ensure that support was in place for that family, and making sure parents understood the impact of their behaviours on the children. Next slide, Kat. So we've talked about perplexing presentation, we've talked about fabricated illness, and now just one slide on induced illness. And this is the most concerning element. This is a case from many years ago when I started in safeguarding, still sticks in my mind. I'm talking many years ago, but this was a child who had a number of confirmed health conditions and a long history of involvement with services under the care of lots of health professionals. Was known to loads of people. I remember he was being seen for a sleep disorder because he would sleep just for long periods of time, or at really inappropriate times. It was really unusual. So all these investigations for excessive drowsiness. There was concerns raised by a new paediatric consultant that came in, bearing in mind this child and family had been known to services for quite a few years and were well known, and everybody knew them, and here he is again, that type of child on the ward. Mum would sit at the nursing station and have a cup of tea with the nurses, that type of thing. A new paediatrician came into the trust and just was perplexed. This doesn't seem right. There's something not fitting here. When the child had another episode, a collapsing sort of drowsy episode, some toxicology was taken, and it was found this child had amitriptyline in his system. He wasn't prescribed that drug, and it's a really nasty drug that can cause a lot of harm to children. He shouldn't have had it, and that was causing his collapse and his sleeps. That was induced illness. So this mum had been inducing illness in the child. It had started as fabrication. So a lot of the conditions that he had been verbalised by mum over years. So mum had told staff that he had meningitis as a child, and he had hearing loss as a result of it, and he had various other conditions as a result of this meningitis. And as this snowballed, so that was in his records that he had meningitis as a child. That had over years, that story had become true. It wasn't true. He'd never had meningitis, and that was sort of all unpicked as this case came to light. He did have some health needs, but a lot of them weren't as mum had described. I came in as this case was just coming to a conclusion. Mum thought I came into the trust is what I'm saying. Mum was imprisoned for 4 years. It was really serious, but the backlash of that was staff, the impact on staff as well. Staff questioning their own practice, not believing that this, really feeling duped and really feeling a little bit stupid that they hadn't seen this, that they hadn't recognised this. And, it was really a really, really difficult time. My question was why? Why did mum do this? And that was the answer I never got. Mum never actually made any disclosures about why she did that, which was really frustrating and adds to our confusion about this complex area of safeguarding. But that's just an example of induced illness. Thankfully, we rarely see this. Next slide, Kath. So in summary, next slide, thanks. In summary, the all this information is, we have pages on the Safeguarding Partnership, Fabricated and Induced Illness page, and flowcharts, etc. are on there. So I'm sure Kat's like a whippet. She'll have that in the chat in a minute, I've got no doubt. But the flowchart essentially is saying, this is what we're working to. Is there alerting signs to possible FII? Have we got clear deception? Now, clear deception is things like, as I was saying, falsifying medical records, putting blood in a nappy, cutting a tube, a feeding tube or something like that. Clear deception. It's not mum saying we've got a GP appointment and we're not actually sure whether she did have a GP appointment. We're talking about clear deception. Induction of illness, as I've just described, or any other immediate risk to the child's health or life. If so, that's probable FII, and we need to make a referral to children's social care immediately and potentially call the police depending on the level of risk. Following that referral, discussions will take place with children's social care and the police about what next steps. Obviously, there'd be a strategy meeting, but it'd be about the immediate safeguarding of that child and children within the family. Next slide, Kat. Thank you. So we don't have that, no immediate risk. So anything else, anything that doesn't fit that criteria is perplexing presentation. So we've got time to think about this and consider it and discuss with family. Professionals having open, honest conversations, getting consent from parents to contact health professionals and involve them, sort of anybody currently involved or the GP, and then the lead professional pulling everything together and considering those that list below there as part of the assessment that we'll be carrying out. Next slide, Kat, thanks. The paediatrician would carry out an assessment of that child's health, and it may be that there's a physical or there's a cause for the symptoms mum or dad are describing, and they're explained as part of that assessment. And if that's the case, no further concern, that's fine, that'll be managed medically. It may be that it's not fully explained. We're concerned about perplexing presentation, and we're going to support parents with a health and education plan. We're going to continue with long-term monitoring. However, if parents aren't supporting that plan and the child's health is being impacted, that's when we'll be considering referral to children's social care. So this is a fairly simple flow chart that we can follow. I'm conscious that this is I don't expect any of you to go away tonight and be experts on fabricating induced illness. I really don't. I know it's a really deep subject that we could talk about all day. But it's just about seeking advice from your safeguarding leads if you've got concerns about a child or family. It's just about having an awareness that this is an area of safeguarding, that we have procedures on, and Kat's popped them in the chat there. I saw them pop up. Thank you, Kat. But that's it really from me in a nutshell. Next slide, Kat.